Now, you may have recalled that previously we did an episode on the essential oil revolution on the importance to be especially careful when you use essential oils during critical periods, specifically during pregnancy or with little children. And the use of herbs and essential oils in pregnancy and children is quite controversial. And this is for good reason. It is because of the ethical considerations of actually testing any products, even natural products, in the mom or the baby, as well as the fact that there aren't a lot of studies as a result of those ethical considerations relating to testing them for safety. There's the fact that whatever the mother and the baby is exposed to in utero could really potentially affect the outcomes for growth and development. And this holds true for children during a time when they are going through an extensive amount of growth and development of their organ systems and mental health and cognitive function. What they're exposed to can have a lasting impact. But there actually is evidence that does exist about the knowledge of herbs and essential oils and how to use them safely in women and children. And in fact, I actually interviewed the very woman, Pam Conrad, who has guidebooks and has established medical standards on how to safely integrate essential oils and aromatherapy into hospitals in the United States. She is a true pioneer. And in the interview in the Essential Oil Revolution, Pam shares with us how she paved the way for medical professionals worldwide to embrace aromatherapy. And this led to her work being the foundation of aromatherapy integration in various hospital nursing settings and midwifery programs. And she's also empowering women worldwide how to safely use essential oils for their mental health and for their children, because she feels that if a mom's child isn't happy, then the mother isn't happy as well. So that's why it's really important to embrace both for mental health. Pam has a vast amount of training. She practiced in medical care centers as a level 1 trauma, ER, cardiology, psychiatric, and women's nurse before incorporating more integrative and holistic remedies. But she's always been interested in that. And we go throughout her whole journey, how she learned clinical aromatherapy, how she actually oversaw this clinical of excellence that started integrative medicine into hospitals, how she forerunned a program for that, and how she was able to study with some of the nurses and midwives and the foremost authorities in England who in the 1980s, way before aromatherapy was even a thing in the United States, were doing clinical trials on using essential oils safely in pregnancy in hospitals. And Pam actually went there, studied with them, and brought that information back. So we now have evidence and we now have ways to set up clinical aromatherapy in hospitals, thanks to Pam in the United States. So this is a must see episode if you are interested in learning more about our history, and if you're a practitioner, how these essential oils were safely used in these settings and what the evidence base suggests. Now, there were 10 essential oils specifically that they used in the clinical studies. There's 5 more that Pam now reviews in her book. She's also the author of these 2 guidebooks on how to clinically use evidence-based aromatherapy safely in pregnancy and children. And she also shares with us some information about the importance of mental health and the number 1 essential oil that's used in the research for anxiety. So we just go through a lot of amazing, amazing things with her journey and just empowering everybody with information. And she also has a mental health aromatherapy logo program to spread the word about how aromatherapy really does help heal mental health. I really wanted you guys to really have some background on the importance of this pioneering work in evidence-based aromatherapy so that you can tell people, hey, there are guidebooks, and hey, we can educate ourselves on how to use essential oils in these populations. If people are actually worried about using essential oils in pregnancy and in children, you actually can get Pam's books and say, these have been clinically used in trials since the 1980s and they are safe. So that is very empowering. So you'll definitely want to check out the Essential Oil Revolution. You want to click on the link in the video description that will lead you to the full episode, along with additional resources and my detailed show notes with additional information from this episode of the Essential Oil Revolution.